John Rafferty, President and CEO of CNIB, sits down with Chelsea Mohler, Research Assistant at CNIB, to talk about highlights of the last year.
So it's truly been an exceptional year. What do you think some of the highlights from this year have been?
You know, we do so many amazing things every day. It's always difficult to think of what a highlight would be. So a phenomenal amount of work went into all of the people from our library services. We had all kinds of our systems were 15, 16 years old, so we replaced all of our systems through to the front end. So we've got some great front end technology on the library that allow people to download zip daisy files. People can now access things using smartphones that we couldn't manage before. So that's very exciting. So our library services also continue to grow. We had about 10% growth in clients on our library services. Did great work coast to coast on our core service delivery areas. Our client numbers and the hours of service delivery we had were up everywhere. We recognized our first Employee of the Year as well as our values winners across the country, and that's very exciting to do as an organization. We have so many people that work so hard. To be able to recognize someone for their efforts in the way that we were able to was great. We put a particular emphasis on volunteer services over the last year, beginning to get some traction with that. So we've introduced a volunteer tracking system. It's not perfect yet, but the fact is that we're now able to track how many people we have volunteering and what type of volunteer services. And we're able to talk when we speak to the community about not just what our paid staff do, but what our volunteers do as well, because they provide hundreds of thousands of hours worth of service and value add in the community. So, you know, from an awareness and public education, our Vision Health Month in May has been growing. So, we had our second Vision Health Month in last fiscal. We've had our third one now as we record this, and that's growing year on year. As is the relationship that we have with optometrists across the country, which I think is great. They're primary caregivers, and that's very important to us. So, you know, there's hundreds of things I'm not talking about. I know, and I'll finish recording this and think, oh, I should have spoken about this or that. I mean, our SCORE program, our kids camps across the country, our scholarships, our Braille literacy programs and writing clubs. You know, you name it. There's just so many things that we do every single day across the country to be proud of.
CNIB really changes lives. What do you think makes our volunteers and our staff so extraordinary?
I don't know. I think that maybe there's some sort of a formula there. You know, kind of very social-minded, very community-minded, a little bit crazy, like to have fun. I don't know. I mean, our staff are amazing, and so are our volunteers. When we deal with you know young kids, and we deal with seniors in their 80s and 90s and beyond. You know, our volunteers and our staff they're incredibly patient. They're incredibly dedicated. They genuinely care about you know, about the lives of the people that we provide services to, and you see it every day. I mean, you know, the interactions that you have. It is quite corny to say it, but it feels very family-esque, and that's the way people deal with everyone around here. So it's phenomenal. I am always amazed when you know, when I see the client interaction that we have. It's just incredible to watch.
What do you think some achievements will be for the year ahead at CNIB?
CNIB has played such a phenomenal role in society in Canada, and it, you know, through world wars and changes in culture and changes in society and the way that we view Canadians with a disability, it really has evolved. But I still think that there's a significant evolution to come, and that's in really moving the organisation and the services that we provide into much more of the continuum of care for Canadians who are blind and partially sighted, and away from a charitable model for the rehabilitation services. You know, it's still unfair, you know, in this day and age that someone whose disease causes vision loss is treated differently by the medical system than so many other disease categories when it comes to rehabilitation and the ability to live independently. And so I think that there's a big you know, directional movement that needs to take place in that area. It's going to involve rallying the community around that issue, working with our partners, provincial and federal governments, to try and make that happen. But ultimately, there are parts of what CNIB delivers today that we're very proud of doing, but really don't belong to a charity to be the source of delivery. So our focus needs to be on moving those services to where they belong within the healthcare system. We can be a service provider in that context as we move forward, and are happy to do that if governments want us to. But we need to stop using charitable funds to deliver services that ultimately should be part of the system. And that would allow us to use that charitable money to do the things that add value to society the way that people would see. The additional literacy programs that we can run, the additional training programs on technology, peer support groups, camp programming in the summer months, etc. So there's so many things that we can do with that money, additional funding in research. We can spend additional money on public education and awareness. So many things that could be done better in the future. So it's going to be a challenge. We're incredibly proud of everything we do. It's all absolutely necessary that the work gets done. But we've got to find a better blend in how we work with governments and how governments look at rehabilitation for vision diseases the same way as they would look for rehabilitation in other disease categories.
Well, thank you, John, for taking the time to speak with us.
It's always a pleasure, Chelsea, and anytime I get an opportunity to sit down and talk to someone about where we are and where we're going, it's time well spent.